Panoramic radiography is an extraoral technique allows for examination of the dentition, maxilla, mandible, sinuses, and temporomandibular joint in one image. We have two equal sections, either side of the mid-sagittal plane, and in the middle we have the midface containing the nasal cavity. We can have bony landmarks and soft tissue landmarks. If you missed my two videos on panoramic landmarks, check them out. I'm sure it would be a very great help. At the end of this video, you'd be able to identify soft tissue landmarks and airways that appear on the panoramic radiographs, as they are important to be familiar with because they can be superimposed on other structures and can mimic pathology. So stay to the end of this video. Hi there, I'm Farida. If you're new here, welcome. If you've been here, welcome back to the Dento Radiology. Numerous radiopaque soft tissue structures may be identified on panoramic radiographs. Let's start from the nose. The part of the nose that you see in the mirror can be imaged in the panoramic. So depending on how big it is or having denser tissue like more cartilage, it will be much more obvious and better imaged. So this is the nose. It very looks like one with the nose nostrils. It shouldn't be misdiagnosed with a supernumerary tooth. Next, we have the turbinates that can be very obvious or sometimes spread out, especially when the patient is positioned too far away. You can see my video on panoramic positioning errors on how this can happen. Something else to add about the turbinate is that because the nasal cycle that you breathe through one of your nose each time, the left and right turbinate can vary in size, be enlarged or shrink. Think about when you are sick, you can only breathe through one of your nostrils. They don't have the same size, so don't confuse them with pathology. Down here we have the tongue arcing across the image under the hard palate, approximately extending from right to left mandibular ramus in angle. This is the dorsum of the tongue. It's like your tongue is spread out inside your mouth. This is the soft palate in both sides. The soft palate extending posterior from the hard palate over each ramus of the mandible. Here we have the earlobes, or we call them pinna. The earlobe and the nose contain cartilage. That is why they can be seen as a radiopaque structure on the panoramic radiograph. Same as the epiglottis that can be imaged down here. It's in the front of the pharynx. And you can see the anterior and posterior walls of the pharynx. Radiolucent air shadows superimpose on normal anatomic structures, and they are outlined by the borders of the adjacent soft tissues. This is the Palatoglossal airway space between the hard palate and the tongue. That is why it's called the Palatoglossal airway space. When the tongue is not positioned in the right place, this space is imaged and can cause loss of the details in the upper anterior roots. So ask the patient to place the tongue to the top of their mouth during the X-ray. This air space outlined on a panoramic between the anterior wall and posterior wall is the pharynx. First we have the nasopharynx, the oropharynx, and we have the pharynx. This panoramic image shows how airway shadowing can mimic pathology. Over the angle of the mandible, the airway creates a shadow. If the patient has a history of trauma or a fall, this can be misdiagnosed as a fracture. In this situation, Knowing the anatomy and sometimes an additional image would be helpful to overcome this issue. This radiopack structure is the ghost image of other side of the ramus. You can click on the link above for further information on my video about ghost images on panoramic radiographs. Something else that might be seen is this radiolucent artifact. It's a part of the airway. When the patient's lips are not closed around the bite block, the oral orifice airspace is superimposed over the anterior teeth. So this is another error in patient positioning during the X-ray. Remember, the majority of these structures will appear symmetric on left and right side. This is a huge hint that what you see is an anatomic landmark, except the turbinates that we talked about in the nasal cycle. Okay, that was all for today. Thank you for watching this video and subscribing my channel and helping me to grow this channel. If you liked it, please give it a thumbs up and share it with your friends. Thank you for participating in spreading out the information to ones it would be helpful. Keep smiling and have an awesome day.